All right, well, it's 10:01, so we'll get started. Good morning, everyone. My name is John Donadio. I'm the Executive Director of the New Jersey Association of Counties, and I'm going to welcome you to this week's virtual workshop on social and human services delivery during a public health crisis. Before I introduce really another outstanding panel of county professionals that we've put together, I just want to take a minute to thank them for their hard work throughout this public health crisis. I've been thinking about this quite a bit, and our law enforcement professionals, our public safety workers, our public health workers all deserve the credit they have for what they've done, to help navigate us through this public health crisis. But I think a lot of the unsung heroes are our county professionals, like our boards of social services, our welfare agencies, and our Department of Human Service workers. I know that they have worked tirelessly 7 days a week, 15, 16 hours a day. Kathy, you and I have been on the phone, all hours of, the night, on the weekends, throughout. So I think that I just want to thank you for your hard work. As I said last week, as just outstanding public servants. So I appreciate it a great deal, and I hope that the public comes to understand, what you've done for these past 9 or 10 months. So thank you for that. One little piece of housekeeping before we get started. And again, this workshop is just going to talk about some of the critical services that our boards of social services, welfare agencies, and the Department of Human Services have provided the state's most vulnerable population throughout the COVID-19 public health crisis. And I know there'll be a lot of questions for this one. If you have a question, please don't use the chat button. Use the question and answer button or icon on the bottom. I think that's the correct IT terminology, on the bottom of your screen. For the panelists, if we want to speak with amongst each other, we can use the chat button. But everyone else, if you have a question, use the question and answer button. We're going to run this workshop a little differently than the ones we had in the past couple of weeks, where I'm going to moderate and allow our panelists to really have a conversation based on some questions that we put together for them that I think will be really, really helpful. And again, a much needed diversion from all the election coverage that we've been enduring for what seems like an eternity. So with that, I'm very pleased to introduce a distinguished panel. So I'm going to start with my pal first, Kathy Lockbaum, who is the Director of the Board of Social Services in Salem County. And Kathy, thank you for being here and always being a great friend and resource for me. So I appreciate it a great deal.
You're welcome.
Next up, we have Kathy Doyle, who is the Director of the Division of Social Services in Gloucester County. So thank you, Katie, for being
welcome.
here.
Good
We
morning.
appreciate it. And say hello to my friend Lisa Cerny when you get a chance. I miss her not being on this panel today.
I will.
And then last but certainly not least, Debbie Ann Anderson, who is relatively new, right? Director of the Department of Human Services in Union County. So welcome to all of you, and we will get started. Hold on one second. I clicked some button on my computer screen. There we go. So, Kathy, we're going to start with you and Katie, and I think that's the way we're going to maybe run this workshop, is where we'll talk a little bit about the boards of social services and welfare agencies, and then kind of move into the Department of Human Services in general. And I can tell you before we get started, one of the challenges that I found when I first started with the New Jersey Association of Counties, 20 years ago now, was trying to wrap my hands around the county government system and the various independent autonomous agencies and constitutional officers and boards and commissions and things of that nature. And I think I finally got it, but I think this panel will help to kind of enlighten some of the folks on here of just the differences between, the different boards and the services, the very important services that you provide. So I guess the first question then is, what kinds of services are available through the boards of social services in your county and counties across the state?
Sure. So the services that we provide are basically public assistance services that are federal programs. We administer the federal programs for public assistance. There are some state programs that we also administer. Those programs primarily across all 21 counties would be TANF, which is temporary assistance for needy families, and that would be parents or a parent with children. There are children on the case. General assistance, which are for single adults and couples with no children. That's a state program. SNAP, Supplemental Nutrition Assistance Program, which is formerly known as food stamps, and then Medicaid services. Beyond that, along with that, I should say, we also provide emergency assistance to those who are eligible for the cash assistance programs. But across the state and in many counties, there are additional services that may be provided through the county welfare agencies. Some counties are the agency that provide adult protective services. Some have other grants that expand their ability to provide emergency assistance. So there are some, 21 of us who operate in 21 different ways, but the core services are provided to everyone. Child support services are also part of that. Adult Medicaid is part of the Medicaid program. We provide case management services for those who are participating in work activities or assessing them to determine if they have to participate in work activities. Those are the kinds of services that we provide.
Kathy, I have two follow-up questions to the first question. The first is, and just a general one, have you seen a general increase in the amount of services provided in 2021 related to COVID-19?
Yes. So there's been an increase in caseloads across the state for especially initially when a lot of folks lost jobs, when there were some challenges with unemployment and people not able to receive their unemployment benefits. I think everyone across the state saw some increases in caseloads. And then I know, and I can speak for Salem, we're still above in some areas, but we did see a drop in other areas once folks started receiving their unemployment, people started to go back to work. Some of those cases have kind of started to go back to normal levels, but we're not at normal levels yet. We're still above where we were.
Mm-hmm. Katie, Debbie Ann, do you have anything you want to add with respect to, have you seen increases in your counties? I mean, Gloucester is a neighboring county, but up north in Union County, have you seen an increase in your caseload as well?
Yes, on the food stamp caseload, I've spoken to our director of social services and deputy director, and they gave me a report, and it's a substantial increase year over year for the food stamp.
We saw an increase also in Gloucester. Once the stay-at-home order in March was put into place, they tripled the new applications coming in. And then, like Kathy said, once everyone's unemployment came through, things leveled off, but the caseload is still higher.
Right. And how did your, and this is a related question, and I have a separate one, how did your counties handle that increased caseload with, and we'll talk about in a little bit, some of the restrictions that were imposed on your offices because of the public health crisis?
So I guess in Gloucester County, Kathy talked about all of the different programs that are administered throughout the county welfare agencies. So here in Gloucester, what I did was, for instance, my child support staff, I was able to move them to take new applications, do the phone interviews, things like that. We moved staff to where it was needed, and that was basically for the SNAP and TANF and general assistance applications. Because of the moratorium that was put in place that residents could not be evicted, emergency assistance, that department wasn't as swamped with new applications and with clients contacting them. So we shifted staff to get clients, and really the food stamp benefits, that was the most important thing at that point that people needed, because some employers did not pay their employees and they were waiting for the unemployment to come through.
And in our case, we there were a lot of waivers that were implemented when the crisis hit, and that saved us. So there were no longer face-to-face interviews required. There were, everything was being done by phone. There were no more work requirements for participants in work activities in order to continue to receive benefits. And because of those kinds of things, it allowed more work to get done with the staff who were here. So that kind of saved us. And still today is saving us because of the volume, because, there were, remember also that during this time, myself and colleagues across the state, we had staff whose kids were not in school, and there were all kinds of issues around trying to get people to come to work because they had these other situations happening in their own lives that made it difficult for some of them. So, not everybody was at full staff capacity. And so I think some of the things that had happened in terms of waivers and like what Katie was saying we were able to, under the public health emergency, you can reassign folks. So that was helpful as well.
Debbie Ann?
I think, John, I will say it's really the teamwork, the staff, the team members at social services, from leadership to all the administrators in our county, really went above and beyond. They, really adjusted to the need. They made a plan. The waivers helped, but a lot of shifting, just as what Kathy and Katie said, shifting happened to different departments, different units to really step in and assist with the multitude of applications for food stamps and, Medicaid and other things that were going on. So I believe it was really a team effort, and the staff adjusted to the need and worked through it with late nights and weekends and laptops, doing a lot of different areas of work to make sure that the public was served, and they were able to get the resources. People were able to get the resources that they needed.
Right. So, and that the waivers were obviously critical because you were deemed early on, boards of social services and welfare agencies were deemed early on, for lack of a better word, as essential services, and were deemed essential employees. I mean, this was going back in March or April, Kathy. So, and county governments never generally closed. I mean, maybe to the public you have to, but the services that they provided by county government never closed. So how, though, is your county, and I know this probably varies, across the state, but how is your county keeping, the staff and the public safe?
So all of our offices, at different varying levels, but across the state, were closed to the public initially. So some counties remained open for emergency type situations, but we were closed from the beginning. That helped us. We also we did some things very early on, because like you said, once we were deemed essential, actually first responders, John, if you remember when we went through that in the very beginning, that was a toughie, because you're right. We've never had that kind of a situation before where, we had a lot of staff who were very anxious. There was a lot of staff anxiety, and there's a lot of hours spent among us discussing different ways that we can keep people safe, and what do we do, and how do we do those things. And it really, across the state, I think a lot of us did many different things, and a lot of that has to do with the fact that we're not all set up the same way. For instance, I'm in a single-story building with no elevator, so I didn't have that challenge. All of my staff had their own cubicles, so I didn't have challenges with sharing space and the social distancing and all of that. So we did some things like, we made sure that we had hand sanitizer for everyone. We made sure that we had disinfecting wipes. We stressed, if you're sick, don't come to work, and, wash your hands frequently and use the hand sanitizer. So we did a lot of things internally to try to maintain safety for staff. And it definitely calmed folks as we kind of were working through that. Probably that was the bigger challenge. The applications, we've been in situations where we've been slammed with volume before.
Mhm.
That's not something we haven't experienced, but staff anxiety around, a public health emergency and feeling like somehow they were deemed the same level as like, a police officer, a fireman, a healthcare worker, when that's never happened before, was probably the bigger challenge. Now we're still not open to the public, but we're still, doing things by phone and mail. I know some of my colleagues have started to open to the public, but it's getting the space you have to accommodate those health and safety requirements that we really need to implement to still keep everyone safe. And so some folks are able to do that. I don't have a lot of space in my waiting room, so we're still not doing those things. But I can tell you that going forward, we're all exploring a lot of different ways of doing things virtually, tackling some of the tough issues around that, not knowing, remember when this all started, I think every one of us, we thought it was a couple of weeks. And now we're 7-8 months into this, and with not really an end in sight at this point of doing business, going back to the old ways. So I think that we're all starting to think about how are we going to continue to do this in different ways.
Great, thank you. Katie, Debbie Ann, anything you'd like to add to that?
Yeah, here in Gloucester County, our county administration has been very supportive. We have regular disinfecting, where we have a company that comes in and the entire building is sprayed. My buildings and ground staff, all touch points are cleaned every hour. We did here in Gloucester, we do have cubicles like Kathy, but the way the cubicles are set up, we did install plexiglass. Our buildings and ground installed plexiglass on all the cubicles. And I think putting all of those, like Kathy said, things in place kind of reduce the anxiety of the employees. We are still closed to the public here. So they're not, we do serve anybody homeless that does, turn up at our door, which happens, weekly. We're serving them. Different instances, we do have to allow the public, just into the vestibule area. But we are working on a plan here because we think it's important to try to transition to, opening to the public. But I don't think every agency, statewide, we're seeing that we can do business a different way. So we're not going to just go back to the way it was. We're serving everybody. Everybody is being served, and the applications are being completed without the face-to-face. We have program-specific phone lines set up, program-specific emails set up, so that we're able to have that contact, with the clients to make sure we can, help them any way that they need.
For us in Union County, it's the administration have deemed all of human services as essential, not just the social services, but aging, youth services, everything. So everything that comes under our umbrella is deemed essential. So what we have done in the social services buildings, we've put up plexiglass, we've increased the cleaning for the touch points, provided lots and lots of masks and hand sanitizers to make sure that the employees are as safe as can be. We do see the public, which is the homeless, they come into the facility. For our American Job Centers, we have not open to the public for that purpose because the volume of unemployment, the lines are really long. We were not able to do that. We also have a scattered schedule for some of our facilities, so we're able to change the start time, 7:30, 8, 9, so not everyone is walking in the building at the same time. We do have social distancing measures put in place, so signage is on the floor and on the walls, 2 to an elevator per time. So really making sure that it's there is a process. We do temperature checks at social services for our employees as well as the clients coming within the building, so that that's also helping. We have our public health officer on speed dial, so if we have questions, we're able to reach out to make sure that, are we doing it right? Do we have the policies? And just recently, for the department, I made it mandatory through the county manager and freeholders that every human services employee get tested every 2 weeks, because if we're in the building and other things. So we were able to pass that policy across the board for human services to make sure, and they could get to our testing locations or mobile site testing units to be tested, so that they're safe as best as we can, provide safety in the work environment. We've done plexiglass within the cubicles and everything. So we really have looked at how to keep everyone safe. Most importantly, for what we have done, a majority of human services, including the Division of Social Services, have laptops and are permitted to work virtually. And as Kathy and Katie said, we know the business model is changing and we have to adjust to those for the future. So we are looking to even acquire more laptops and others to see that virtual environment. And we are also, due to Director Williams, who is the head of social services in our county, she has requested working with our vendors to do interview booths. So there's got a touchless, a contactless interviewing, so that is self-cleaning and everything. People could go in like an old-fashioned phone booth, but it's more, for the interviewing. So that will be coming in the near future. So when we do have to meet with people face-to-face, it's not really face-to-face as a booth, and it's all through video conferencing.
That's really interesting, Debbie Ann, and leads me to I guess a follow-up question, and touched upon it a little bit. So if I need services, how do I apply for those services? I mean, we talked a little bit about the internet and the email and the phone booth technology type thing now, or video conferencing. So how can one apply for benefits in this environment?
So I think a lot of the times, people are going online to NJ Helps to apply for different things. If someone, because we know there's a challenge with digital divide through the COVID crisis, sometimes people do come into social services and get the paperwork and fill it out and turn it in. And then that's when the phone banking, the phone operators reach out to schedule appointments, talk with people on the phone, and get more detailed information. So it's more on that phone, virtual kind of environment to get people the services that they need. And it's a lot. I know my team downloaded so many applications online through this COVID crisis, and that's how clients were able to serve. And that's what we've been doing in Union County.
How about in Salem and Gloucester? Same thing, mostly online. Folks have the accessibility to that?
Yeah, online applications, we stress that. But again, not everyone has access to a computer or the internet. So we do provide paper applications in our vestibule, so they don't have to come into the office to get them. They can go into the vestibule, pick them up. We have drop boxes in the vestibule as well, so people can return them, or they can mail them. So they can drop off those boxes in the boxes. Pretty much, though, we haven't had, believe it or not, we haven't had a ton of paper applications. We've had some, but the majority of folks are applying online, which is encouraging. That helps people too, because if they apply online, that application date is their date of application. Whereas if it's a paper application, when they bring it to us, that becomes the date of application. So it locks in their date of application for their benefits if they apply online. So, we tell people, if you have the capacity and you're able to, if you have a neighbor, a friend, an organization where you can use a computer and do that, that certainly is the recommended way of being able to apply for benefits.
Yeah, same here in Gloucester. We encourage online applications, but we do have paper applications available for all programs and a drop box for them to, return their paper applications.
Great, thank you. Has there been an increase in the services available to residents through COVID-19? From?
Yeah.
Where did you see that?
Well, there's been a couple new programs. They had, New Jersey was approved through the feds for the pandemic EBT program, and that was an additional SNAP allotment that was issued to children who were receiving free or reduced lunch within their school system. So the state of New Jersey, they rolled that out. It was early July that the initial issuance was completed, and that was completed then by September 30th.
Mm-hmm.
Now with the public health crisis, every time the governor extends the public health emergency, we're now approved. They're going to request those approvals on a month-by-month basis. So every child did receive those benefits. Then there's also the CHAP program that here in Gloucester County, I'm administering that program, and I believe Kathy is doing it for Young County. It's through the SSH funding that comes through Human Services, and that's a COVID housing assistance program. The online applications opened up and were actually closed down within 3 days because of the number of applications, and that was for anyone who had rent arrears, mortgage arrears, starting in March, and they lost their income due to the public health emergency. They can then apply for those arrears through our office. It's online, and the applications are sent to our office, and they do the evaluation. So there are two of the newer things that we're now doing in the social service agencies.
Right.
The other thing I would mention also is that anyone who was not receiving the maximum allotment for SNAP, every month that there's the public health emergency is extended, those folks are getting the maximum allotment of SNAP benefits. So if you weren't, then you are. If you were getting the maximum already, obviously there isn't any more available to those families or those individuals, but the maximum allotment of SNAP is also available to folks.
Okay, and let me ask you, I want to go back to the waivers for a second.
Yes.
So how long are the waivers just last through the declared public health emergency, or that's unknown at this point?
Actually, some of them are dependent, like we just talked about the PEBT and the SNAP maximum allotments. They are dependent on the public health emergency declaration by the governor, the extension of that. But there are others that have been are allowed to continue. It's a state option, and those benefits are allowed to continue through the federal fiscal year, so through September 2021. And others are not necessarily, they're waivers that have been requested through the federal government because our state plan or state regulations state that we have to do things in a certain way. And those things, for instance, face-to-face interviewing and some others, may not have to continue if there's the ability to change those things through our state plan. So those kinds of things are being researched right now, because obviously if we go into a virtual environment, or we can, some of us who can go into a virtual environment may not be able to do face-to-face interviewing in a way that keeps folks safe. So some of these plan changes could happen that have nothing to do with the actual federal requirement as much as it has to do with New Jersey's approach to implementing the federal programs.
So can that approach be enacted just by the Department of Human Services legislatively? Or, and I guess because what I'm getting at is it's something that, and you were once the head of the County Welfare Directors Association, which is just a tremendous, association that meets on a monthly basis and talks about these issues, as is, the Association of Human Service Directors, at Lisa Cerny is the president of both organizations, meet on a regular basis. Is this something that these groups, along with NJAC, can advocate, to make these changes permanent, to make it easier for you to do your jobs and serve the public ultimately?
I think that at this point, the Division of Family Development staff are actually determining what things can be changed through a state plan process and what things need to be changed legislatively. And so there's more to come on that. And don't worry, John, we'll definitely reach out if we need assistance with that, because there, in a lot of cases when things like this happen, it forces you to look at doing business a different way. And we're all, everyone is reevaluating every single thing we're doing and how we do those things right now. And what does it take to make those changes? So, so I think that if there's ways to do it that we don't have to go through the legislative process, I think that will happen. And for those things that have to be done through the legislative process, I expect that there will be some outreach from the department to get those changes made if we need that to be done. So we'll keep you posted on that.
I appreciate that. And listen, anytime that you can avoid the legislative process, it's a very good thing.
Yeah.
So Katie or Debbie Ann, anything you want to add to what Kathy said about the state plan and the waiver process?
No, we're happy with waivers right now. Like Kathy said, it's helping the agencies to be able to get through the number of applications and to serve our clients efficiently during this public health emergency.
So before I have some specific questions for you, Debbie Ann, I just want to go back for a minute because I'm not quite sure of the entire audience. So I think it might be helpful for maybe Kathy and Katie to really explain the difference. And I get this question all the time from legislators and other folks, the difference between a Board of Social Service and a county welfare agency.
Okay.
Just
So
a general, just a 30,000.
And we are. Kathy is a board. I am not a board.
yeah.
Right.
So
Perfect.
boards were established many years ago. We have, there's the board laws, which is Title 44, determines who our board members are, how the boards have to be comprised, and it's very specific. There are a certain number of citizen members, the county adjuster, a certain number of freeholders that get appointed every year. They have citizen members have 5-year terms. And that group is the governing body of the county welfare agency. So, or the boards of social services. So from that group, we obviously, as a county welfare agency, are really supervised by the state because all of our programs, all of our monitoring, everything comes through the state oversight because we are an extension of them in terms of the majority of our funding comes from them, but the counties do contribute. And then there are other counties. We're probably split almost equally right now between those that are still remain as boards and those that have been brought into county government as a division of social services and not an autonomous board. So they would all be county employees and part of their own county government structure, whereas we are, as boards, are not. We're not part of county government. We're separate entities, and still all provide the same services, primarily.
Yes.
Okay. Katie, that sums it up?
That sums it up. Here in Gloucester County, I am under, like Debbie Ann explained in Union County, I am under the umbrella of Health and Human Services. So I have the Division of Health and Human Services and Social Services, the Health Department, Human and Disability Services, Senior Services, are under that umbrella with me. And then we report to our county administrator and our board of chosen freeholders.
So is there an advantage, and then maybe I'm putting you a little on a spot. I mean, is there advantage to one structure over the other for delivering the services, not necessarily from the governing body's perspective, but in terms of the delivery of services to residents? Is there a benefit to one over the other?
The same programs. Kathy's aboard, so she may have, but I don't see a difference. Kathy, you can probably comment it since you're aboard.
Kathy's saying very bad words about me right now. I can tell.
It's a very touchy subject, John.
Yeah.
Very touchy subject. I mean, you know, we've had discussions about this over the years. I mean, from the perspective of providing services, I really don't know. I mean, I don't know. Staff, maybe from the staffing perspective, it might make a difference because, you know, going through county staffing versus not. I don't really know that part of it. I wouldn't really know that part. It's just a different way of doing business. And I think that, you know, it's things that we've talked about over the years, and there's a lot of history to some of these things and reasons why it's happened. And I think that that's the touchy part, you know. And
well, I apologize for
I'm
that
not going to
question.
offend any of our attendees by going into any more than this. And you know better.
You know, you're right. I apologize for that question, and I owe you two now. So, but can you just, I have one more thing that I think needs explaining, just a general overview of your funding sources. I mean, I know we talked a little bit about the federal government, state, county, you know, et cetera, the pass-throughs type of stuff, but just a general overview of like where your funding comes from and the percentage.
So so we have multiple funding streams on the federal government, state government, and also our counties. Some of the federal programs require a county participation in terms of a matching dollars for our programs. Some of our programs are block granted through the state, so we have maximum amounts that we can spend. And if we go over, then there are county dollars that have to pick up the tab. And then you have things like the GA program in particular, which is 100% state dollars. Again, those are block granted funds that we get. We don't have to match those funds, but if we go over what the block grant amounts are for those programs, we have to pick up the tab. So in terms of percentages, obviously it depends on how much county participation your county, each individual county may, what the will is there. So in some cases, there may be certain programs that they are willing to contribute more than what the federal requirement would be or what the matching requirement is, because they have specific circumstances in those counties that they want to address. For instance, maybe elderly, you know, needs of the elderly, or needs, there's a higher level of homeless, or other kinds of emergency assistance type programs, and they want those funds, they're willing to put those funds in. Child support services, straight up 66.6% matching federal dollars. So the county puts in about a third and the feds put in 2/3. The TANF block grant money that we get is a 50-50 match. We have a block grant that we can't go over. If we can go over. If we go over, it's more county dollars. But to draw down that any of the money, the county has to put up 50%. So that's that food stamps same way, 50% match for counties. And then the block granted programs are case management programs and the GA program, and we have a 75% match for social service block grant programs. So we have these matching programs. So overall, the county participation, depending on how much they want to throw into some of these social programs, can vary across each county. The other thing I think that is unique in some of these, in some of the funding, with some of the funding streams, is that you don't get the money if you don't spend the money. So we operate on a reimbursement method. So we can't draw down federal funds if we don't spend the county funds. So even though you might get an allotment or a matching, a block grant that requires matching, we can't get TANF block grant money if we don't spend county money to get that. We can't get the 2/3 child support funds if we don't spend the 1/3. So you have to draw down the federal dollars by spending your county dollars, if that makes sense. I'm an accountant by trade, so I get all weirded out, nerdy and technical in my explanation. So if it's confusing, just stop me.
No, I thought that was very, very helpful. Thank you. Thank you, Kathy. Katie or Debbie Ann, anything different in your counties?
No,
No.
basically the way Kathy explained.
All right. Great, Debbie. I know you've been participating, but I know you've been waiting for some love from me, and I'm going to give that to you right now. And just if you could just recap real quick, because we've really been focusing on the boards of social services and the welfare agencies and the services they provide. And you did touch upon it a little bit, but just give again a quick recap of the different services and your role as a Department of Human Service in Union County.
So the Department of Human Services in Union County is the largest department that covers the Division of Aging, the Division for Individual and Family Support Services. We have the Division for Youth Services, Paratransit, Social Services, our cornerstone, which is our mental health, county-run mental health hospital. So all the different touch points of human services delivery, and we also focus on the American Job Center, the operation side of the workforce development team. So we are touching all the human services resource delivery aspects except for health. Our Department of Public Safety handles the health portion. So everything else human service related sits under us. So the Division of Individual and Family Support Services, that's where our continuum of care sits, as well as our Office for Persons with special needs and disabilities. So our aging, that's where Meals on Wheels occur, and all the other caregiving and all the other programming specific for the aging, our senior population. So it's a large one. So we've been busy since the call to the executive order to shut down for COVID. So it's been a long haul, and it's still continuing to go.
So it sounds like you have obviously a lot of moving pieces. How do you communicate with all those different community partners that you have in Union County, which I'm sure is similar across the state? But how do you do that?
So, we, in most counties, there is a Human Services Advisory Board, HISAC. So we communicate with them, but what happened through COVID is how do we focus not just on the human services delivery, but just how do we respond to the nonprofit partners through COVID and keep an open lines of communication. So we established the Union County COVID Crisis Consortium that is made up of our key stakeholders of nonprofit partners within Union County. We meet on a monthly basis, and it comprises of the human services leadership, county government, and the nonprofit community. And it's intent to have an open dialogue based on what are the basic needs that the nonprofit has. How can the county government assist with addressing during this pandemic? So for example, some of our partners needed access to PPE that we as a county would. So we work with our Office of Emergency Management to make sure that all those nonprofit partners in our county who needed access to PPE were able to get it as soon as we had it available.
So are there like subcommittees or task force within that consortium that help to, again, communicate and implement, the services?
Yeah, yes, they are, John. So what we found was we did a survey, we took a survey of all the nonprofit partners and what they thought were some of the top challenges they're facing through COVID. One subcommittee that was developed through that was the Housing Stability Task Force, because rental assistance, mortgage, all of that through COVID is going to be a problem. And even though we're going to get federal and state funding, it's not going to be enough. Could you imagine the amount of people that are 6 months behind on rent? And, although we have the executive order, it's going to run out at some point. When that is lifted, we all know that the inventory is not available for the amount of people that possibly can become evicted and homeless, et cetera. So we're trying to put a plan in place with that. Then the next piece of it was food insecurity. Food insecurity was a challenge before COVID, but now COVID has hit. It's just been, the need has been crazy. So what the county has done is partnered with the community food banks to do weekly food distributions of 2,000 boxes of food, shelf-stable food and produce through the CARES Act funding, to make sure until the end of the year that if families need food and they don't really can access food stamps, because they're like maybe $1 or $2 more than what the requirements and eligibilities are, they can go through the drive-through or walk up throughout the county and be able to access food. Then we're looking at a plan how to move forward. Then we built a task force for the public-private partnership, and that's fundraising, helping the nonprofit partners fundraise as well, because we know as a county, we can't be the answer. Yes, there's county dollars, but how do we bring in other private partnerships, private foundations to come around the table to say, okay, this is a complex issue. How can we solve some of these problems of basic need for our communities together? So bringing people like Community Foundation of New Jersey and other foundations around the table to really have a robust conversation of what's next, how to get through COVID and what's next, because we all know the CARES funding is going away, but we still have to provide critical services, and how are we going to do that?
Right. And, there's a couple things I want to follow up on, because Union County was one of the 9 counties that received direct federal CARES Act monies. The remaining 12 counties, because their populations fell below 500,000 or less, did not. What were some of the specific programs that Union County implemented to help further your mission directly related to direct federal CARES Act monies?
What we established a child care for a safe learning program for child care. So any of the kids that are between the 5 and 13 that were on the free and reduced lunch programs throughout the county, and their parents had to return to work, we were able to provide funding to child care centers and the family, so the children can go in a safe learning environment, and we would pay a portion of the funding through that. The other piece through CARES Act, we provided funding for the nonprofit communities for PPE, a grant up to $20,000, and which is reimbursable, as well as we're adding technology portion, because a lot of these expenses were not foreseen due to COVID, and they had to react and respond. So we're putting CARES Act funding to that. As a county, because our social services team members were deemed essential, and all essential county employees, the county leadership decided to use the CARES Act funding to pay for childcare for safe learning from ages 5 to 15 for any county employee that have to work. We would pay full amount of the childcare for the employee to come to work using CARES Act. And then the last was using the funding for the food distributions through December. for the food baskets and so on and so forth, working with ShopRite, working with the community food bank, and working with Stop and Shop.
Thank you, Debian. I mean, we have asked New Jersey's congressional delegation for an extension of the CARES Act funding and to spend down those, those monies. We'll make sure to keep you posted on that. But my question now is really for Kathy and Katie, because your counties were, 2 of the 12 counties that did not receive, direct federal CARES Act monies. We did receive monies from the state CARES Act dollars, but it's very restricted in how we spend that money down, and much of it is limited to testing. And when you have counties, and Union County will face this as well, where you have revenue shortfalls, you have increased expenditures, you have surplus depleting. What does your county do? I mean, because this also requires a significant discretionary investment from the governing body. Like, what are your plans moving forward? How do you address these real, financial factors that are going to squeeze governments across the state?
So since we're not part of county government, we wouldn't be part of the CARES Act funding distribution that went to the county. We wouldn't receive those funds, but we did receive an allocation from the Division of Family Development for some COVID related expenses. We just got that information in October. The letter, I think, came the end of October, and we have to have our expenditures done by December 1st. They're letting us go back to September 1st to charge any COVID-related expenses towards those allocations. What's interesting is I'm listening to Debbie Ann talk about all the things that they were able to offer in Union, and that's great that they were able to offer those things. What I find challenging is just, this hit in March. We all had wet budgets by then, right? So even things like little things that cost a lot of money when you're buying them for lots of people. Our computers that we have for work in our office, they don't have webcams. They didn't have, we didn't work that way. So we had equipment expenditures that we needed investments that we needed to make. We thinking about, just like you said, the enhanced cleaning and buying supplies and, all those things that you have to do that we weren't planning on doing prior to COVID. They are budget hits, and there are discussions that you have, or we had internally. How much of an investment do we make in certain areas? Because if it's only something that's going to last for a couple of months, it doesn't make sense to spend lots of money on something that we won't need after a couple of months. Well, then a couple of months turned into more than a couple of months, and you start thinking about things in a completely different way. But along with that, they weren't things we planned for. They just weren't things we planned for. So you're limited in some areas. I think we're limited in what we can do. And even, Katie talked about, I think she talked about, I know they did this in Gloucester, and I think she talked about this, that, having people work overtime to process applications and do all those kinds of things. Well, yeah, because we had an onslaught of applications when this started, and you're trying to get people help that they need. But again, under normal circumstances, would we have done that? We may not have needed to do those things. So it's interesting that the way that the dollars were given to certain counties and not others, and obviously we're really small. We were coming nowhere near 500,000 residents in Salem County, but we still have a need. We still have poor people. We still have people who needed, a food distribution would have been nice, or even the child care. I mean, the state did do some work on the child care piece for our essential workers, which is great, but I'm sure that there were many things that we could have benefited from in our county had we had that direct allocation. And quite frankly, in the beginning is when everyone needed it. Like when it first came out is when people needed it. Getting it laid on and saying, hey, you got a month to figure out how you're going to spend this stuff. We know in government, that's not always an easy thing to do. So I think we all just kind of did our best to figure it out, but it's very different circumstances here than it is for those counties that were direct funded. That's for sure.
Right, Kathy, Joe Costantino agrees with you, and he says, as we kept clients out of the office and interviewed via phone, more documentation went back and forth in the mail, as many clients lack the ability to send digitally. So thank you, Joe. Hope you didn't mind me reading your comment there. And yeah, Kathy, I couldn't agree with you more. And it was really, at the DC level that they came up with the formula.
Yeah.
That you had a population of 500 more. And we did advocate all along for some state CARES funding. And although it did come down the pipeline, there are restrictions that are making it difficult for the counties, to spend down. I don't believe any of the counties have actually seen any of the state CARES Act funding yet, as we're still in the application process on several different components of it. We're grateful for the monies. Hopefully the deadline to spend it down for both the state and those 9 counties is extended so we
Yeah.
can plan for 2021, because it just doesn't appear as if this public health crisis is going away, anytime soon or as quickly as we'd like it to go away.
I think that would be helpful, John, just from the perspective of if you have big dollars and you're trying to plan projects that you didn't know you would be able to do, that just takes time,
Right. Right. So before I open it up to questions, because we are almost out of time, Katie or Debbie Ann, is there anything else that you'd like to add?
No, I agree with Kathy. We're pretty much the same. Our county administration has been very supportive. So we basically used our whole overtime budget that was just approved in our new budget for 2020 in March and April, just so that we could make sure our clients were served. And, they were very supportive. Do whatever you have to do to make sure that you're serving your clients. We were able to get the PPE that was needed, and it was all just the postage, just the extra mailings we were doing. Like we were spending, a budget that was to last the entire year of 2020, in 2 to 3 months earlier this year. So it has been, difficult.
I'm just pushing, John, that I'm hoping and have my fingers crossed that we can definitely get the extension. Because now, since we're embarking on Code Blue, serving the homeless population during COVID and trying to find placements in hotel motels and shelters and isolation and et cetera, we're going to break the bank. It's going to be a system breaker if we don't have the resources, the money to continue. So anything that we could do on the legislative side, greatly appreciate it, because we really need that support.
Yeah, I wish you wouldn't have brought up that Code Blue, because that stuff, boy, man, we had been battling that. Not that it's certainly not well intended, but the way that was implemented with the lack of funding and how disjointed it is, man, and we testified over a 2 or 3 year period to that, and now we're seeing that, particularly heading into this winter. So I think that is certainly an agenda item for a follow-up conversations with both your organizations. I very much appreciate your time. I'm going to open it up to any questions, which all of our participants can put in the question and answer session icon below. And if we doesn't look like we have anybody, because I think you did a fantastic job over the past hour. And again, I just want to thank you, Kathy, Katie, and Debbie Ann, for taking the time out of, I know, just crazy hectic schedules that you have. I appreciate it a great deal. This was very helpful for me. I learned quite a bit, as I do every time I speak with you. And again, just thank you for your time.
You're welcome.
Thank you.
You're welcome.
All right. Have a great day. All right.
You
And I
too.
do owe you
Thank
2
you.
or 3, Kathy.
You might.
We have a question. Hold on 1 sec. Oh, thank you. That was a thank you. All right. Thank you.
You're welcome.
Have a good day.
Thank you.
Thank you. Bye.
Bye.